talk about thermotherapy as opposed to cryotherapy, which is heat as opposed to cold. So the other day, what we did in the lab is we used hot baths, right? So we used the hydrocollator and the hydrocollator. How deep is the penetration associated with heat from hot baths? 2 centimeters. What's a centimeter? How many centimeters is an inch? Or?
It's 2 centimeters is a little over, right?
It's 2.5 centimeters is an inch.
Okay, you all need to look that up. You all need to look that up, right? I tell you, you forget, but you look it up too.
2.5.
So when we use hot baths, we need to use specific layers. Moist heat is very different than dry heat. A cold pack is very different than an ice pack because the conduction is greater than you have something like cold ice. As opposed to ice will heat the body a lot quicker than an ice pack. Moist heat, we need to have layers between ourselves and the patient in order to prevent burning. And those layers are how much?
6 to 8.
6 to 8. Was you okay? Yes, I feel for you because I'm a little concerned. So therapeutic heat, what is heat? Heat is the internal vibration of molecules inside the body as well as noise. Then we transfer this heat from something that's from the patient's body to from a cold pack or a hot pack to the patient's body itself. And what happens when we have heat? We have an increase in dilation, right? Physiologically, what's happening? If we have core temperature increase, what would happen to the blood pressure?
Core temperature would increase.
Blood pressure should drop. The pulse rate should
Increase.
And what should happen with ice?
Opposite.
The opposite, right? Blood pressure should increase, secondary constriction, and pulse rate would decrease. So cryotherapy controls inflammation, and how do we know when somebody has an acute inflammatory response to anything?
It's warm, edema.
Hot, red erythema, pain, and loss of function.
What else?
Pain,
Redness,
loss of
edema,
function.
what else? Pain and
Loss of function.
So we would know when we can use ice and when we should use heat, and that's really important because as we discussed the other day, or at least we looked at, we have paraffin in there. And paraffin is heat and oil, right? Wax and oil, I should say. And when we use the paraffin, we have to know, can I use it on somebody who has RA? And how do we make that determination? If it's a chronic condition versus an acute. So we know the difference between the two. Okay. So conduction. Conduction is that heat that's lost or gained by direct contact. So what modalities do we have that are direct contact? So usually it moves from the higher to a lower temperature. And it's temperature then eventually increases and there's a therapeutic effect, right? Or the temperature is the same. Actually, the therapeutic effect of heat when we use a hot bath probably is only lasts about 8 minutes. If that's all, just a lot of fermentation. Okay, so in order to have therapeutic effect, we need a biological stimulus needs to reach a certain temperature, and that temperature is So conduction, the types of conduction that we use, modality, when we're speaking about modality, is paraffin, which is the wax, and a hot bath. Convection is that movement through air where each part, whatever it's an air or cellulose particles or water will be touching the skin at different times rather than just one surface touching another surface. So there'll be many times when these water particles will be touching. So that is, and it heats more rapidly, and those types of modalities that we use are whirlpool as well as Fuller therapy. And whirlpool and Fuller therapy are used, and they're used at different temperatures because they have different specific heats. So we will have to know what temperature we have we use with the modalities in order to get that biological or physiological effect. Conversion is converting a non-thermal energy or a mechanical energy, let's say, or a chemical energy, or even an electrical energy into heat. So there's magnetic energies, there's electrical, there's mechanical energies, converting them from that non-thermal state to a thermal state. And an example of that is water, as well as diaphragm. So when we talk about diathermy, we'll talk briefly about it because you probably won't see it that much anymore. But there's different, there's magnetic and electrical energy that's transferred into heat via some process or electrodes that are attached to the patient. And then this chemical response that occurs in the patient. Radiation, transfer of heat from a warmer source to a cooler source, and that's an infrared lamp. We have infrared lamps. And can anybody think of another thing that's associated with radiation that's not a modality? What transfers this heat from a warmer source to a cooler? The sun, right? Fireplace. Evaporation is then transferred from a liquid to a gas state, and that happens when the skin or the tissue absorbs this energy. It evaporates and changes from this liquid to a gas state, and something that we have associated with that is something known as a vapor coolant spray. They used to use that for chloromethane spray, and then they banned it. And they have different, I'm not sure exactly of the, I think it's at the bottom, so I'm bringing it up. What they're using right now, but there is a vapor coolant spray that when you spray it on, they say that the spray is the stretch is the action and the spray is the distraction. So I don't know if anybody has ever seen vapor coolant sprays used for cervical, yeah, you have, Jake, you have, Nancy, or for hamstrings or for anything. So how do we, what does that principle work on if you think about the pain cycle? What are we stimulating as we're spraying? Mechanical cells, right? So the spray will be the distraction and constructive movement. And so types of superficial heat, we said, was a whirlpool, paraffin. These are all like 1 centimeter, 2 centimeters the most. Deep heat are diathermy and so diathermy and ultrasound can penetrate from 2 to 5 centimeters, depending on what frequency we use.
So the paraffin is more for chronic issue?
Paraffin?
Paraffin.
Yeah, paraffin's heat. So would you use heat on a heat problem? No. And we'll talk about the types of paraffin. Just think about somebody's got an acute ankle sprain. An acute ankle sprain, if you wanted to put somebody in a whirlpool, would you put them in a whirlpool? A cool whirlpool or a warm whirlpool? You put it in a pool, right? Or you use ice. In concentrations, of course, associated with anything. But the other thing you have to think about is if I'm going to put somebody in a whirlpool, then their leg would be in a dependent position. So if you have a great deal of edema, and you're putting that person in a dependent position, is the appropriate place. No. So maybe you would change your modality, and you would use an ice pack, ice chips, cold pack, and you know.
Just want to transfer for 1 second. Radiation and conduction are both.
One's direct, one's indirect.
Really different.
Correct. All right, so what is this specific heat? It says here it's the amount of energy it takes to raise a given material by a number of degrees. Generally, that number of degrees is 1 degree. Okay. So that's the specific heat. Skin and water have a higher specific heat than fat and air. also has a higher specific heat than something that is corn cobs that are used for fluid therapy, which are cellulose compounds. And when we think about specific heat, materials that have a higher specific heat take a larger amount of energy to cause that temperature to change, and it also holds the heat for a longer period. Therefore, in order to transfer the same amount of heat to a patient, any thermal agent that has a high specific heat, like water, so when we think about whirlpool, they're applied at lower temperatures than modalities or materials that have a low specific heat. So a whirlpool would be used at a lower temperature than fluidotherapy, because fluidotherapy are corn cobs and they're associated with air and convection and circulation, and that the corn cobs have a lower matter with a high, or material with a high specific heat needs more energy, right? To achieve the same temperatures as those with a lower. Think about it. Sand has a lower specific heat than water. So the sand can be really, really hot, but then you go into the water and it's not so hot. And you ever be when you're on a beach and you can't even walk on the sand, and then you run into the water to cool off, because if you're walking on the sand, you'll burn. Because that doesn't require the same amount of energy to change the temperature. Right? So that's all specific heats. So, and that's an important thing to note, because we have to know why we're choosing, if we're choosing whirlpool, why the temperatures are lower than something that has a lower specific heat, like fluidotherapy. And fluidotherapy, by the way, I just found out, is not on the state board, but we're going to go over it anyway, just so that you can see if you use it, because it's kind of a nice modality to use. So what does heat do? It causes vasodilation. So what does that do to blood flow?
Increases blood
It
flow.
increases blood flow. It produces an analgesic effect, meaning that it makes you feel better. Right? It promotes muscle relaxation. Increases the viscosity of connective tissue. So how is it good for muscle? Yeah, it is, because it relaxes and it actually stops the muscle spindle from firing. So it's not a great thing to use prior to an exercise. If you want somebody to use their muscles, we don't want to put heat on. It's not good for strength training. Yeah.
So in the reading, it was saying something about like how heat has like an extensibility, like it helps like kind of not stretch the muscle, but it helps kind of like make it a little bit more.
It lengthens the muscle.
Lengthens,
So it
okay.
increases the flexibility of it.
So is that,
Through vasodilation.
does that not have anything to do with strength then? Okay.
No.
In respect to the textbook, they mentioned that there was a decrease of 30% between strength and muscular endurance. How do they measure this metric? Is it relative across the board, or do you know anything about that? Like, how did it measure? Like, they'd say specifically 30%, or is it just like a ballpark figure that they put out there?
They probably had some specific patients that they used. You know, they had like a little a target group that they used, but is that generalizable? Yeah, it's not. But it depends what their research was. That was in the camera?
Yeah. It was under there.
But they probably did, I mean, they had to really do, what did they use? Did they say that they used biofeedback? I mean, a biofeedback or Biodex or something like that to look at peak torque over time or anything like that? I'll look at it. All right, so it increases blood flow, increases edema, increases leukocytes and phagocytosis, which is good for right? increases collagen, decreases muscle spasm. How does it decrease muscle spasm? It gets its usually notified. Alright? So it decreases muscle spasm by fire. So we want to I'm sorry? It decreases muscle spasm by getting GPO to 5. Actually, firing of both the tendons and the muscle spindles do not fire. But it inhibits muscle spindle firing and you get a both. Therefore, it decreases muscle spasm. Okay. Contraindications, acute inflammation. It's more important to know the contraindications than the end. Because nobody's going to ask you what people will say what it was before, but they'll say what function. So you're not going to use it for malignancies, right? So if somebody got cancer and you don't know if they have malignancies or not, you're not going to use it. Take the relation of red. You can use the metabolic rate, you probably spread. Somebody's hemorrhaging. Now, a hemorrhage, you think about as somebody who is, gushing blood. But don't you have micro tearing of muscles when you have an injury? Like even dogs, delayed onset muscle spasm, micro tearing of muscles, right? So if somebody comes in and they said they worked out and they really feel sore, are you going to give them a hospital? No. Somebody comes in and says, I just had a lip lynching yesterday, are you going to give them a hospital? No. If you sleep over. But it's not indicated because you have micro tearing and you have bleeding and it's going to make it worse. Okay, so keep that in mind. Any area that's over radiated. So if somebody's got high radiation, secondary cancer. Anybody with cardiac insufficiency, unexplained pain, VHF, support bill, acute infections, coma, thrombophlebitis. Precautions and acute injury, at least within the 72 hours. Okay, 72. You got that acute whiplash, you're not going to lose ice. Cardiac insufficiency, again, vasodilation, we don't see cardiac demand. You have to know how severe the patient is cardiac problems. And open wounds, people that see people bleeds. Demyelinated nerve, somebody who has demyelinization, you know what I'm talking about. What's demyelinization mean? Nerve supply. So the nerve supply is gone, do they have to take precautions before? If somebody is truly asensate, not going to use it, but if the area around it is okay, you can still use on that area, but not directly over the patient. Pregnancy, if somebody's got a low back problem, be careful, especially in the next one. And older adults and children, why?
Because
What do we know about older
they're like
adults?
receptors, something about the receptors being, they can't detect it.
Well, their skin is thin, right? The skin is thin. An older person has thinner skin, has collagen, etc. And what about on metal?
No.
Metal is conductor. What about aqueous tissue?
It's a conductor. It's a conductor of heat.
Is it
Or it
conductor?
insulates, I'm sorry, insulator.
Right, so the difference between no. So when we talk about things like diaphragm, if something is not, if something is a conductor, it may absorb more, right? So we have to be careful with specific things. Pregnancy?
Yeah. It was talking about, hyperthermia. Yeah, since my wife probably understood better everything. She thinks like scalding hot showers for 20 minutes. Should that be exactly about? Or is that?
It's really more of a static thing. I mean, more of a force. You just take the shit. Nobody's taking contracts, right? This is like, no, they're talking about it when you like in your last trimester. And you're placing it over the abdomen or placing it over the back?
Yeah, so where did that now?
You did it last time, first time.
Yeah.
Boy or girl?
Girl.
What's her name? Oh, Virgil.
No.
Oh, it's that, that's good.
You got one?
Anytime, right?
You don't have any?
No.
Oh, Cindy has two, right? That's it from you? And gotta give him some tips on it, isn't it? He won't be sleeping in the morning. All right, so examples of superficial heat, a centimeter or less than a centimeter, get over your hot pack, moist heat, the hydrocollator is 158 to 167 degrees, right? The important thing about this, other than the fact that the number one cause for loss of sperm is the fact that if you get a new hot pack and you just take it off the shelf right out of the box, it takes 2 hours to heat. And it also takes 30 minutes to heat between use. So what did I say? We want that 40 to 45 degrees.
May I have your attention, please? Our College's Coronavirus Task Force needs everyone's full cooperation and adherence to the CDC's COVID-19 guidelines when you are in the building. Everyone must wear a face mask at all times in public areas of the building. Everyone should observe social distancing, which is 6 feet apart. There should be no more than 2 people on an elevator at any one time. Everyone should wash their hands frequently, and if you feel ill, please stay home. Thank you for your cooperation.
Everybody hear that?
I have Monica and Brian. I'm not Monica, Melissa and Brian here. I have 2 on here.
Oh,
I
okay.
have 2 on my computer.
So,
Ryan,
And Melissa are on computer.
So it takes 30 minutes to heat between use. How many times are you in the facility? Those of you working in something. It's a busy night, all the hot packs are being used. And somebody just puts a hot pack in, and they tell you to look at how you take that same hot pack. What are you doing for, what do you do? You might as well stay home. And you were not getting a violent, you're not getting not heating. Does the patient still feel good? Yeah. But is it not healing? So think of that. And that makes you feel really upset.
you were saying that there's a high specific heat, right? High specific heat is that.
No. We talked about trafficking in a conductor. Specific heat, we're talking about materials like water, air.
But that is a good conductor.
Fat is it's an insulator. It's not a conductor. Or cold.
Oh, multitude.
Yes.
That's really medical statement. Are you saying that like only considering the
If that's all
for
they get.
just heat?
Yeah.
Okay, that's right.
Because that's really not doing it. I mean, they usually get heat to stand or heat with something. Or heat prior to exercise, right? People are like, oh, we get hot back before exercise. Don't you think exercise will do more than the heat? Exercise will do more. But people like heat. People like ice. Well, they don't. All right. So 6 to 8 layers of insulation, a towel. I've not been using, but a towel should be used between the patient's skin and the hot pack covers. Why? Especially these days. Why? Because you're going to use that same hot pack cover on somebody else. What happens when you put heat on somebody? You have an increase in vasodilation, and what does the body do to throw off that heat? It perspires. So now you've got a wet back, and it's on a hot pack cover that you're gonna put somewhere to dry until the next person comes in, and sometimes you don't, and you put that same hot pack cover on somebody. Right? So especially today is what's going on. COVID. Right? right? You need a towel. Consider the body part to be treated. So if somebody has a cervical problem and they don't like to lie supine or prone, how would you set them up? Let's say spinning.
Like,
You want to sit.
You don't like to supine or prone?
They don't like to lie supine or prone.
they can sit,
They don't like to be silent.
they can sit up in a chair,
Yeah, with the chair.
You put them along sit, okay, anything else?
or in a chair.
Normal sit.
It's a good chair.
Because when you sit up, don't your neck muscles need to hold your head up? So if their neck muscles are hurting because they're overused or they're in spasm, is that a good way to do it? If they don't want to lie down? How about if you sit them on a table, put several pillows on the table, and have them lean like this? All right, lean on the pillows so that their head is now flexed and they're not holding it. Right? And know that we have all different types of hot backs, right? We have cervical hot backs, we have small low back, we have large low back, we have hot backs that we can use for the knee, we have hot backs we can use for the shoulder, etc. By the way, what's the least favorable thing to use when you put on an ace band to secure it? What's the least? How many of you got that wrong? And we said it was pins in this very class.
No, I didn't get that one.
Yeah.
Okay? We said it was those, not safety pins,
Yeah, clips. Clips,
Clips.
Yeah, I
yeah.
did it wrong.
clips.
And then.
That's
No, it was clips and then safety pin. It was clips.
all right, application of hot packers. Remove the jewelry. Why?
Yeah, those little snappy things.
Right, because jewelry and metal have a high thermal conductivity. And when you glue the jewelry, what do? Give it to the patient, right? If she says, take off my necklace, you don't take the necklace off and put it in the bag. You just take it off and hand it. You do 6 to 8 layers, you use the towels, you know how to count. The layers, each two layers. Always provide a patient with a call bell or some kind of a device, whether it's a bell or a timer or something, and inspect the skin after 5 minutes. All right? How is it going to be easier to inspect the skin if somebody's prone, supine, or sideways? Well, this is going to have the greatest conductivity. Somebody's supine, prone,
Supine.
Fine, which is gonna have the least one.
Sideline.
Okay, and a lot of times to increase conductivity, when we put somebody prone, we take a weight, and we put the weight over the hot. You ever seen that? Okay. Be careful of that when you're going to be using stim and heat. But sometimes you set the stim up with the heat, and then you walk away and you say, I'm going to make sure that hot pack stays on, and then you place a weight over, and the stim that you adjusted it for is not the same because with greater conductivity, it's going to increase and that person's going to jump.
So using stim and heat together is to increase conductivity?
No,
Oh,
using the weight is going to.
using the weight.
Going to increase the intensity of the stim when you put a weight on it.
Okay.
So you need to know that before you go and put the weight on it. I submit that, no, you don't. You set them off and then go and get the weight, place the weight on. Sometimes with your hand over it.
For the heat purposes, you could just use less layers too, as long as it's still 6.
The only way, you never see anybody and I'm sure you haven't, use 6 to 8 layers. You see people using a lot less. Sometimes in the hospital, they really pay attention. But sometimes in the outpatient facilities, they use like 2 layers and think that's enough. And it's not. And if you're not observing the skin and the tissue, then God bless you. because something's gonna happen. You know, if a person says, I don't feel it, just say, give it a minute, but make sure you check after 5 minutes. I mean, everybody's got different resistance to current flow as well as to conduction. Everybody's got different resistance. And resistance can mean a lot of things. Resistance can mean, topical ointments, you know, like creams that people put on because they say, oh, my skin is really ashy, and then you start putting all these creams on, or somebody might be really hairy. That's going to all provide resistance to any kind of current. So you need to know that. So you're going to treat everybody equally.
So, you said that sideline is the why is that? Sideline position.
Sideline condition, Cookie? Yeah, that's the least. Don't you guys think that? I mean, those of you who tried sideline, because the sideline, it's really just, you're trying to get it over a body part, I'm pouring it over a body part, and it doesn't work. It doesn't stick. When you're flatter, if you're not just flatter, you can go on it.
The graphic again,
Right, so the different types of Copax, and everybody knows what a hydrocolloid is, and everybody knows how to measure. So paraffin. Paraffin is good for distal extremities, so it's either the hands or the feet. You see we use it a lot from nail shops and things like that, but we use it for therapeutic value. It'll help soften the skin, and again, it's heat, so it'll increase vasodilation and help with movement of the extremities, especially if something's like a tendon repair or something like that. Then you want to get the hand to move. The ratio of paraffin can be 6 to 1, can be 7 to 1, so this paraffin's mineral oil. And what the mineral oil does is help lower the melting of the paraffin. That's why they add the mineral oil. So these paraffin units can be anywhere from 126 to 134 degrees Fahrenheit, a couple of hours. 125, 27. Well, you measured it. Yeah. Okay, so there's a glove dip method, which is what we did with Devin's, but we didn't do it that many times. Generally, it's 8 to 10 times, but when we're going to do it in class, we're not going to do 8 to 10 times. 4 times is sufficient to have a company. Okay, so get the person to put the hand in, you guide the hand in, do not touch the sides, do not touch the bottom. Bring the hand into the wax, bring it up, let the wax drip off. When you lower the hand in, it's important to just go to the same level you did when you did it first. Why? Because you're going to start to develop coating and a protective covering, and then if you start dipping in it more, it's going to get hotter in the areas that have not had that. So 8 to 10 times. Then you'll place plastic or glove over it and a hot pack cover or a towel. And generally you leave this on for 20 minutes. Remember what I said before, any kind of heat therapeutically is probably going to reach its peak by 8 to 10 minutes. Paraffin will also, but it buys you time, and it also feels. So there's also a way that you can paint, use a paintbrush to paint it. They do this with burn patients that have peels. You want to increase collagen extensibility, and you want to increase the length of a specific muscle that has been damaged, the collagen under it. And you can take a paintbrush and paint. The advantage of the paraffin is that it can conform to these irregular areas. It's inexpensive. You can elevate the body part when you use the paraffin, but it's messy. You can't use it with an open wound, so if anybody has an open wound, it's a touch, you have to can't do it. And you can have cross-contamination. You reuse the paraffin. I remember when I first started out, they said, oh, there's no such thing, and you can reuse the paraffin, and what we did is we took the glove and put it back in there and let it melt and use it again. You're not doing that, okay? What you have to make sure that you do, wash the hands before Patient must wash their hands and under the nails and everything. If you have fake nails, you have bacteria, sometimes that's associated with what's in the nails. We don't want to put a patient in there with fake nails. Okay, so wash the hands, use paraffin. And there's also an immersion method, where you just take the hand, dip it, and leave it in. I have never done it, and I have never seen anybody do it. There's a risk of burns. However, I have to mention this, it's something you may want to ask Roy Bond about, but I have never done it.
With the burn patient, you have to do that 20 minutes later and start to heal, right?
Oh, yeah, after it's healed. Okay, fluidotherapy. Fluidotherapy has a lower specific heat than water, so we use it at a higher temperature. Okay. So generally, we have it from 100 to 118 degrees Fahrenheit. There's another 20-minute treatment. It's cellulose corn cups. It feels like water based on convection. It's easy to use. You can put a patient, if you have a wound, you can put a plastic bag over the wound and tape it and place the hand in there. You could put more than one person in it at a time. And you could also work with the patient once they're in. There's different portals that open up, and you can actually put your hand in there and work with the patient's hand or foot, if you need to, while they're in. Problem is that the limb is in the dependent position, whether it's the hand or the foot. It's messy because the corn cups go all over the place and it can become very slippery and messy. Okay. But we do have one. They cost $5,000. We got a unit given to us when Bergen went under, so Bergen gave us their unit. And so we have it, so I might as well show it to you. I don't stay for it. But you could see here, she's in it by herself, and here the therapist is in it with the patient working with her hands. Okay, cryotherapy is using water, so cold. So what's the normal progression? It's a normal progression when you put ice on something. What should they feel?
Well, first cold.
Cold. You should feel cold, then it should burn. Feel a little burning, feel a little achy. Then they start to feel nothing because, it's analgesic. It's numb. And those are the normal progressions. So if somebody says it's cold, it's burning, it's achy, it's analgesia and numbness. Okay, again, this decreases muscle spindle activity. So it decreases the firing of those A delta fibers, causes vasoconstriction after cold 50 degrees Fahrenheit. Initially, you can get, if your overall body temperature starts to fall, you get cold-induced vasodilation. That's what it says, 50 degrees. It's cold-induced, and that's more protective. The prolonged exposure to biofilm ice, you get a reflex of vasodilation. But just with topical cold, we're getting vasoconstriction. Decrease edema, promotes an analgesic effect. The brief icing can facilitate the firing of alpha-1 So a brief ice can, if you may do it with somebody who has like Bell's palsy or something like that. Bell's palsy is a temporary transient paralysis of patient. So we could quickly grease ice to try to get the alpha-1 required to get the person to use. But this is brief ice. So you could even do brief icing on somebody who's a CBF. Remember, we do a quick stretch, we do a CBF, brief icing will stimulate that muscle spindle. They'll learn to work. If we want to decrease the hypertonicity, then we would have to do something slow. And the brief icing would not. Okay?
Brief icing is for.
Brief icing to stimulate, fires the alpha-1 will fire with brief icing.
When would you want to use that? When would you want to use that?
When would you want to use that?
I kind of was.
There's somebody, I see it a lot with people that have facial problems, facial palsy or Bell's palsy, which is transient. So take an ice pop or an ice cube or something on a stick, where the cryo cups, and briefly or quickly ice in the direction of the muscle fibers, to try to get the patient to and do the activity at the same time to get the alpha motor neuron fire to make the muscle. Okay, indications, spasticity, acute inflammation, muscle spasms, edema. Contraindications, Raynaud's disease. The Raynaud's disease or Raynaud's phenomenon still, just remember Raynaud's is this digital cyanosis of the fingers and feet.
I just need to come up there.
Yeah, it's a systemic disorder. Cardiac dysfunction, again, open wounds after 48 to 72 hours. So open wounds will deter or it'll prevent the healing of the wound. Somebody who's hypersensitive, that's cold urticaria. They have sensitivity to cold. Arterial insufficiency. Cryoglobulinemia, serum protein, you won't know this unless they do some kind of blood work, and ischemia will result as a result of this. DVD and hemoglobin, that's from ruptured blood cells. But they'll let you know. They'll have blood work and they'll say that, ice is an indication. All right, cryocups, this is immediate ice. So, would you do this for 15 minutes? No. So the direct contact it brings the vasoconstriction immediately, just happened over time. And if I were going to use a cryo pump with somebody or an ice massage, it would be fine. And you use an ice massage after like some kind of a stimulation or some kind of a manual technique. Often commonly used, I'm sure some of you who are in clinic know if you do the transrestriction massage across the tendon, right? That's when we do those. When we have something like a bicipital tendonitis or a lateral epicondylitis, maybe you would use a myelophoresis or something like that. But if you were using ultrasound, you're doing cross-friction massage, you would cause an active inflammatory response, right? So we're going to now tell the brain this is an inflammatory response. We need to bring everything to the area to try to promote healing to that area. So we'll do it with ice. Okay. So we would do an ice massage. All right, and this is controlled cold compression units. I'm sure you've seen them. It's not only apply ice, but also compression. So the compression as well as the ice will help decrease the edema. Okay? You have compression units, people that have knee replacements and people that have shoulder problems, shoulder injuries. I'm sure you've seen this before. They have this cold compression units, so they have to fill up this. It's very expensive because you have to fill up this big tub of ice and you have to get a lot of ice, and then you place this cup on somebody, it's attached to the unit. And you turn it on, and the unit will both compress and get colder and help with it. So if somebody is, let's say they have total knee replacement, they'll live with this for weeks because it feels good. It gets the inflammation down. And then there's little handheld units you can use, BioFreeze, and there's topical things that you can use. Okay, this is the sprayer stretch. Here it says search. The stretch is the action, spray is the distraction, right? So the stretch is the action, spray, distraction. Why? Because you're spraying, this is the thermal receptors we're picking up, the mechanoreceptors. We'll be picking it up and sending information to the spinal cord to do what? We're not stimulating nociceptors because we haven't done anything yet. So mechanoreceptors are going to the spinal cord to do what? To the gate.
Open.
Close it. And so that's how this works. All right, stimulation of mechanoreceptors will close the gate, allowing us to perform a stretch. Okay. And ability of motor neurons. This is the ability of motor neurons through stimulation of the nerves. Okay? Apply to guided parallel strokes over the muscle, you see what it looks like. They're now, this is the, but this is the floor that they spray that's out now. It used to be different. But they found out that it was carcinogenic, so they changed the chemical makeup, and now this is what we use. All right? You don't have to know that it's pentofluorocobane and tetrafluoroethane. You don't have to know. You just have to know that it's branch. You get your sleeves over the muscle. Usually you go from the margin to the insertion. You can go from the insertion to the margin also. And then if we do this a few sweeps, you do a passive stretch. So you hit it at a 30-degree angle, about 12 to 18 inches away. Then spray the entire muscle, and then you stretch. And do this. It does work, and it does feel. Anybody ever have it done? No. It's done a lot of times for trigger points. You see, this moves a lot higher pressure. Okay. So hydrotherapy. What's hydrotherapy? Water, right? So what's Archimedes' principle? When you immerse a body, when you immerse a body, it exerts an upward thrust equal to the water displacement. You know that. So the greater the mass, the greater the thrust. Jump in water, it's going to exert a thrust upward. Depends on how dense you are. Buoyancy is that force that's experiencing that upward thrust. Okay. Viscosity is the resistance to flow. So, if I increase the speed of something, so if I'm in a treadmill and I have waves that I put in, somebody's in aquatherapy and they're on the treadmill that's underwater, and I introduce waves, this viscosity will make it difficult, right? So if I increase the speed of the waves, it would make it more difficult for the patient to move, because it would provide resistance, so it would make it more difficult for the patient to exercise. So we could use it to our advantage or not to our advantage. If it's flowing against us like a wave, it makes it more difficult. If we're going with it, it actually helps us propel. You know, think about going into the water itself. If the wave is coming this way and you're riding the wave, it's going to push you in it and give you less resistance. But if you're going to try to walk against it, it's obviously going to really provide more resistance. And hydrostatic pressure is that pressure that's exerted against the skin, and it increases as you go deeper into the water. So you get a greater hydrostatic pressure. So is hydrostatic pressure good for you? Yes. Absolutely. So if somebody was non-weight bearing, would it be a good idea to put them in the 8-foot end of the pool and give them a noodle? You know what I'm talking about, a noodle like to hold on to so that they don't sink. Yes. They were non-weight bearing, to be a great way to do it in the beginning.
Because then they're dependent, right? So.
Well, they're dependent, but it's not like they're staying in one place, right? Because they have a noodle and they'd be moving. So what happens when we talk about dependency, we're saying avoid dependency because of venous return. But if you're moving, then your muscles are contracting to aid in the circulation. Okay, so hydrostatic pressure. So it increases venous blood, right? Increases venous blood, which eventually does what? The cardiac output. Does it increase stroke volume? Does it increase cardiac output? Yeah. Yeah. Does all this. So, is it good to use? Is it good to do a good modality to use somebody's got?
No.
And then pressure on all surface of the body at rest, increase in proportion to death. That's that whole thing. I said it increases with it. I guess that's. So the whirlpool operates on both conduction and convection, right? And you have to mention conduction because where there is a hot going to cold and cold going to hot. But also convection because the speed at which the whirlpool is working. You get an increase in perspiration. It's good for debridement. Get vasodilation if it's something that's moving with a hot, vasoconstriction, muscle relaxation, increase in range of motion. It'll help you work with. Again, I said if you have a when we have these devices for these, you can direct the flow of the water specifically where you want it. So if you wanted to assist with the person's range of motion, or you wanted to resist the range of motion, you can place the agitator in that direction. Okay. And it's good for debridement, but is it selective or non-selective?
Non-selective.
Non-selective. So you may get some good stuff off too, as well as stuff you don't want. But you see it all the time. This is a low boy, so if somebody is in this, they have to sit in it. So do they have greater or lesser conduction than somebody who is just sitting on a high boy and have their legs, their ankle? Where is this person having greater conduction and systemically getting more of a vasodilatory effect? In a low
In
boy,
the lumbar.
because they're gonna be sitting up to here. So somebody maybe who you would put in this might be paraplegic, who's got a sacral ulcer, right? Is it the best for them to sit in it? Not really, but it's a whole lot less money and time than to fill up a other tank. But they would be probably sitting in this. A level. Yes.
So you would put somebody in there with an open ulcer.
Can you put somebody in?
With an open ulcer, you said?
Yes, yes. So they're sitting, so their head would be here, and their trunk would be here, and their legs would be here. And this is a high boy where you'd be sitting here, and your legs would be in here. This is a Hubbard tank. Now, a Hubbard tank has many gallons, and it has a stretcher system and its hydraulic system where you move the stretcher and hook it onto this overhead device, and it brings the person right in. So you see this. What the problem with this? I've had many patients in this.
They still look exactly like this.
Yep.
They still look exactly like this. It's just how many? I don't even know how many gallons.
It's
You have many gallons of water here. And you have to get it to a certain degree, so you have to play with these hot and cold, right? Because we want 102 degrees, 140 degrees, you want to make sure that's ready for that. And it takes a long time to fill up, it takes a long time to clean. And if you have somebody in there and you see this stretcher system and the person's on this stretcher, you have to have somebody in that room at all times. You know, so that the person doesn't slide in or go. And the angle, the inclination is not that great, the person's not gonna fall in, but you never know what might happen. Right? So the person has to be there 100% of the time while someone is in. And this is when somebody has a lot of ulcers, or, you know, one large massive one that you can't do anything else with, or somebody can't ambulate, or somebody can't move well. I had I think she was about 500 pounds. They did hip replacement on her because she was and the distance occurred, and what's that mean?
A wound opened up.
To some kind of infection, yeah, and you kind of put her in a local to clean up that wound, because it's the whole, her leg was this big, you know, her thigh was. So what's gonna happen, soft tissue is just gonna pull that apart even more, so we had to put it in here.
Yeah.
But I had a lot of patients, burn patients, little children, 5-year-olds that had burns over, more than 50% of the body. And at that time, we used to go in. Of course, you don't do that anymore, but you know, at that time, yes.
But is it safe to assume if you're putting somebody with a burn or like an ulcer, you're draining it, cleaning it at the time?
You're draining what?
You're draining the whole thing, cleaning it
In between patients.
Yeah.
Oh, in between patients, yeah. You have to drain the whole thing, you have to, clean it out.
Yeah.
Takes a long time. So you really have to have an
There's
aide
a solution.
that is very organized and can schedule these things appropriately. Because the aide does all this.
Yep. Yep. I do this at work at the hospital. It's a lot. And it's definitely, it's like sad because a lot of the patients have either like stomach issues, like they have like surgeries post-op, a lot of like private area infections and things like that. And it takes a long time to fill up and it's a pain in the butt to clean.
Yeah.
But
And they may have all kinds of tubes, you may have an NG tube, you may have a G
yeah, when
tube,
they have
you
an
may have-
IV, we have to wrap it with like plastic wrap. You have to make sure that if their blood pressure is too high, you don't want to put them in that because it vasodilates and that's not good. So, it's a lot.
So you have to really know what you're doing when you.
And they usually come with like 5,000 attachments anyway. So
How many gallons of water are there?
I don't know the exact measurement. I know that there's a weight limit. You can only put someone who's up to 300 pounds in it. We're not supposed to put, because the whole pulley system and the whole like, it's a lot.
Yeah,
So.
we gotta do it very gingerly with this.
And sometimes what happens is they're not ambulatory, so we literally have to slide them onto this,
Yeah.
and it's not comfortable for them.
You got it, usually what you do is you'll bring the stretcher up to the room. You'll bring the stretcher up to the room and you'll get him from the bed to this stretcher. And then get him into the water and then get him back out and then bring him back up and get him back up.
Fantastic.
And I do it all by myself, because the therapists are usually preparing all the dressings and stuff. Unless you really need help with the patient, they have you do it yourself.
How long do they stay?
20 minutes?
Yeah, it depends on like the severity of the wound, yeah. Usually 20 minutes.
And do you find any nice things in the water?
A lot. It's not fun.
No, it's really not, I mean, you think about but this person needs this.
Mhm.
This person needs this, so you have to, you can never.
Clean it, get in there. Gotta get in there.
I know a friend of mine used to do a wound care all the time, and what she did was she put Vicks under it. Put Vicks under it. Anytime she worked it.
I chew gum under my mask, just so it's
Yeah.
minty. It's
hot.
It's hot.
It's very, very hot.
Because you're supposed to set the temperature, because their whole body is being submerged.
Yes.
It's good. If it's cold, it's
Right.
not comfortable
They're
at all.
freezing
So.
because their whole body is being submerged. They lose body heat, so the room has to be very warm.
And
So then
yeah.
you with your lab coat, your mask, and everything else is very, very.
Yeah.
Okay. So indications for that: wounds, subacute inflammatory conditions, early peripheral vascular disease, peripheral nerve injuries, muscle weakness, or just people that have other open wounds for some reason. Contraindications: venous ulcers, right? Venous ulcers, contraindications, and same of those things. Okay, temperatures. And this you need to commit to. Okay, I'm telling you that now. You need to commit to. A very hot whirlpool will be 104 to 110 degrees. That's for soft tissue extensibility, increased soft tissue extensibility for chronic pain patients. Hot is 99 to 104, that's for pain. Mild, warm is 96 to 98, that's for burn patients. Neutral, 92 to 96 for open wounds, circulatory problems, and cardiac disorders that can withstand heat and decrease tone. Tepid whirlpool, 79 to 92. That's for exercise. If you want to exercise a person with acute inflammation that can't tolerate cold, you can always use tepid whirlpool. Then a cold whirlpool, 32 to 79. Okay, so these numbers you should know.
Looking at the 99 and 104 and the 96 and 98, you said both those for pain?
96 to 98 for burn patients.
Okay, I'll go for patients.
Yeah,
Okay.
neutral 92 to 96 for, open wounds.
Okay, got it.
Okay. So for aquatic therapy, the same principles apply as for hydrotherapy. The water temperature when you're in the pool is 79 to 97. Yeah.
Yes, just to refer patients for water.
Yes, yes. Yeah, for burn patients. When you're especially, that's not that bad. Aquatic therapy, 79 to 97. For light exercise, 93 to 97. For more intense exercise, you lower the temperature. Shouldn't go between below 65 degrees. And think about the immersion. So if you're immersed in water to the neck, the percent of weight bearing, the depth immersion, you're about 90%. You relieve your weight bearing at least by 90% when you're at the level of C7. Okay? Cycle process. So remember, you have an increase in hydrostatic pressure. So with hydrostatic pressure, what happens? You get an increase of venous return. What happens when you get an increase of venous return? You get an increase in cardiac volume. You get an increase in the stroke volume. So know that the deeper you go, the less weight bearing you need. So at the level of the neck is approximately that you're actually on weighted yourself about 90 to 93%. Okay. So it's easy to move. You could do progressive weight bearing. You could work with a patient when they're in water. The person can move their body in all directions. You can guide them in movement, and you can perform a lot of types of exercises. Did you go to the aqua therapy in Central State? No. There's a lot of places that have aqua
The
therapy.
PTA worked with, did that in Center State.
Yeah. Like, again, you have to be a certain kind of person to want to do that all day, because it's exhausting. It's exhausting. The room has to be warm, you're warm, you're in the water all day, you're working with the patient. And it's a certain amount of fatigue sets in.
I was in Pennsylvania when I was living there. I worked as a dean in a place where we had hydrotherapy, and they had an underwater treadmill.
Yeah.
With cameras, so they could actually do gait analysis underwater. It was awesome.
They have a lot of those, and some,
That's really cool.
I think one of the facilities we have, Sandy Hook has it. So the disadvantage is it's time consuming, it takes money, and aqua therapy is going to have limited carryover. Okay, there's a lot of studies. In fact, I had to do a lot of research when I did my thing on the knee and for my PhD, and they found that aqua therapy, when we're looking at strength and you're looking at function, you don't have great carryover numbers or some things like that. That kind of makes sense, right? All right. Precautions, if somebody has bowel bladder incontinence, does that mean you can't put them in? Can you put a paraplegic in? Sure. If you're on the bowel bladder program, I do that. So, yeah. So, be careful if somebody who has an infectious seizure, the one that will be moved, of course, somebody with seizures, somebody who has trach tubes, you don't want water in the trach tube, severe cardiovascular disease, and somebody who has insulin, right? We're using water for mobility, not insulin. We don't want to stabilize someone. But if somebody is non-maintenance, so this is a picture of, you could see her, she's underwater, here's the treadmill. So she's walking on the treadmill. And she's at her chest level, so it's going to be a decrease in the amount of weight bearing that she's going to have on her lower extremities, secondary to the water. Okay? And there's lifts. If somebody's not weight bearing, they put you on a lift to get you in and out. And then there's noodles to help with floating for somebody who doesn't swim. And there's also these fins, which will provide resistance. Okay, so the increase in stuff. Contrast baths. We're going to use, you don't see this much anymore, but it'll increase the blood flow and increase the tissue temperature without increasing edema. So when we do contrast bath, we're going to have 2 containers. You always start with warm. Okay? Always start with warm and end with warm. So it's warm and cold. So you take two different buckets and you put one in warm, one in cold, one in warm. Then you immerse it for about 3 or 4 minutes. Repeat it to finish it warm. It's used for more chronic problems, chronic edema, chronic inflammation. okay? Also for hypersensitization. So if somebody has a problem with sensory deficit, or not a deficit, but hypersensitivity that they can't, they don't like cold, they don't like heat, this would be a good thing to start. Okay, so there would be two different things set up, and if you do them over extremity, one would be warm, one would be cold.
I actually have a patient now with, little ankle, and he had chronic edema, like hitting edema. And we did this, and this is the only thing that was working.
You know, some of the old country guys were always so excited.
Yep, well, he was able to do it at home daily on his own, and what did
What did the setup look like?
So, yeah, we just did a hot pack for 4 minutes, and then we did a bucket with ice and water, and went back and forth. And then he did it on his own at home, and the results are great. If he can tolerate, your patient can tolerate, it's not comfortable.
All right, I'm gonna end with these three laws, but I told you that in order for a biological stimulus to occur, or physiological effect to occur, that a certain minimal stimulus is needed to initiate that response, or that biological response. And that's known as the artificial intensity, okay? So this is heating those tissues to 40 to 45 degrees Celsius. That is what's needed in order to begin that biological response, to initiate that biological response, or that physiological response. So if you're not heating the tissue appropriately, then you're really not doing anything physiologically. That's that artificial response. In order for something to work, you need to have some kind of stimulus that promotes this response. Okay? Then when we talk about we're going to talk about light therapy, and we're going to talk about infrared, and we're going to talk about ultraviolet. And these principles, the principles that are involved in this are something known as the cosine law for electromagnetic radiation. It's also called the cosine law as well as the inverse law. So the cosine law is that the absorption of that ray is optimal when you're at 90 degrees from the source. Okay, so you have to be perpendicular, so you have to place that modality, whatever it is, perpendicular to whatever you're treating. So if I'm going to be treating the shoulder, and I'm going to be using diaphragm, I'm going to place my drum or my coil or whatever it is 90 degrees from the area that I'm being treated. Plus, there's a certain amount of distance you need to be able to check. So that's just optimal when you're treating perpendicular to the surface. Inverse square law is different. So the intensity of the radiation is inversely proportional. So I equals 1 over d squared. The intensity is inversely proportional to the square of the distance between the surface and the source of radiation. So if you put I equals 1 over d squared, that's inversely proportional. So if I have the intensity of 100, then I equals 1 over 100, or 1 over 1, that's 100, right? So that's 1. If I move it 2 inches away from the source, it's now I equals 1 over 2 squared. So what's intensity equals 1 over 2 squared? What's 2 squared? 4. What's 2 times 2? 4. 4. So the intensity has now decreased to 25% by moving it 2 inches away, and it's also covered a greater surface. Okay? I use the example. Anybody have a flashlight, a little flashlight? Look, if I put see now that there's two rules that apply, right? I have to be perpendicular to the source, so you're not going to be able to see my hand. But can you kind of see my hand?
Yeah.
Right? See the light? So now it's bright and it's localized, right? As I move it away, it gets dimmer and it covers more surface area. So it's 4 times the surface area that's covered if I move it 2 inches away, if I follow that rule. Intensity equals 1/2 squared it is decreased, the intensity has decreased to 25%, but it has increased over the surface area 4 times. Okay? That's what the inverse square root means. Alright, so optimal treatment is at 90 degrees, perpendicular to the source of being treated, and we have to understand that as we move the radiation away, the same principle applies to X-rays. As you start moving the radiation away, you're decreasing the intensity as well as increasing the surface area that you need. Okay. Those 2 laws you should know, yes.
So, going backwards a little bit, specificity, that decreases with cryotherapy.
Spasticity, if we want to decrease spasticity, we can use ice.
Cryotherapy, and
Yes,
no
quick
effect,
icing.
no effect of thermotherapy. I couldn't really understand, with your spasticity, the type of, yes.
We do a quick icing because the quick icing will facilitate the bone spin. And it'll decrease the alpha motor neuron fire.
Interesting. So,
We're not gonna do prolonged icing, you know?
in the thermotherapy, that would decrease a muscle spasm, but it won't have any effect on spasticity. Why is that? If the thermotherapy will decrease a muscle spasm, but it won't have any effect on spasticity.
If heat,
So thermotherapy, it will decrease when a person has a muscle spasm, like if their muscle is like spasm, twitching,
well, if you have a muscle spasm or you have a knot in the muscle, yes.
but it has no effect on spasticity.
Well, it's because spasticity, you're gonna have that firing all the time. So you're not gonna have, it's not gonna bring it's gonna vasodilate, right? The heat will cause vasodilation, but it won't, because when you have spasticity, you get such quick firing, the heat is not going to affect it. It's not, no. Because after 8 minutes, it's gonna stop all the quick. So. All right.
I do have one more for you.
Go ahead.
I'm jumping
No,
in.
yeah.
So when you say multiplying the hot fluid therapy,
Yes, well, laser, mostly the cold laser, right? We're gonna be talking about laser.
So, for acute injuries, and I can ask you more about this in my too, but for an acute injury, why would you want to use, and I don't want to, go against the gospel or whatever, but why would you really want to use much ice or cryotherapy when a person has an acute injury? I figure you'd want to have that inflammation, because inflammation is going to increase the metabolic processes, it's going to get the healing agents to that area, it's going to
Well, what's the edema gonna do?
My thought is the edema is going to give it kind of like a natural cast to immobilize it so that you don't hurt
There's a
yourself.
lot of schools of thought on that, because a lot of people say, why are you taking a pain medication when pain is a natural warning to your body? Why are you taking the pain medication? But if you have an acute inflammatory process going on, you have to get rid of that acute inflammation in order for you to be without pain and get rid of that edema.
Don't you kind of want you want the inflammation though?
Do you? I mean, if you have an acutely inflamed joint, you're going to get destruction of that joint.
How does that operate?
How does that happen?
Yeah, how does that work?
Well, the swelling will cause a decreased motion. As it causes decreased motion, it also causes compression of the bone, right? So now you have two surfaces that have, maybe you're getting, I'm trying to think of the word, where the bone will start to break down, but as the bone starts to come together because of the compression, it causes more of a wear on the bone, so it causes more breakdown.
Good question.